So it's 10 p.m., your kid suddenly wakes up crying, clutching their legs, and you're thinking, is this something serious, or is it just growing pains? You've probably heard the phrase 100 times, maybe even used it yourself. But what does it actually mean? Are growing pains real, or just one of those medical myths we've repeated since childhood, like don't swallow gum, or it'll stay in your stomach for 7 years? As a parent, I get it. Those middle of the night wake-ups are stressful. Your kid's in pain, you're exhausted, and all you want is reassurance. Today we're going to cut through the confusion and figure out once and for all what growing pains are. And maybe more important to some of you, what to do about them. Welcome to another episode of Hey Doc, Quick Question. I'm Dr. Jeremy Alland, and on this podcast I answer your health questions, quickly, clearly, and with a little bit of humor along the way. Today we're answering one of the questions I hear most commonly from parents. Doc, could this just be growing pains? And the coolest thing is, one of our younger listeners actually called in with this question.
Hey Doc, quick question. What are growing pains?
So let's get right into it. First and foremost, are growing pains real? The answer is yes. Growing pains are a real medical condition. They're recognized as a common benign pain syndrome that happens in childhood. They are among one of the most common causes of limb pain in children. That said, the name is a little bit misleading. When you hear growing pains, you would think that somebody was naturally getting longer or taller. But in reality, they aren't caused by the bones actually stretching or specific growth spurts. Because of the age that they're happening at, which is usually kids who are growing, they are called growing pains and we associate them with growing. But in reality, it's just the most common at that age group and we don't actually know if the growth is causing it. So what do growing pains look like? They're often intermittent, meaning they come and go. Bilateral, meaning on both sides, usually in the legs, and oftentimes at night. And anybody who's had a kid who's had these knows they usually come at night. It's never at a convenient time. But the first thing you should know is, it's real pain. Your kid's not making it up. These are most common between 3 and 6 years old, although it can happen between 3 and 12 years old. And again, as I mentioned, it's usually in both legs at the same time. So they may complain of having calf pain or thigh pain, very nondescript pains, not in one specific location. And the pain usually is bad enough that they'll wake up in the middle of the night and say that they have terrible pain, even though when they went to bed they had no pain at all. The first time this happens, this can be incredibly concerning. As a parent, when your child wakes up crying in extreme pain and you haven't seen anything like this before, it can put you on edge. Do you need to go to the emergency room? Is it something serious? Is it an emergency, or is it just growing pains? We'll get to that. One of the more frustrating parts about this too is that when they wake up in the morning, they're usually pain-free, and then throughout the day, they're normal. They play sports, they run, they play with their friends. They never complain of pain, and you're like, are they just making it up at night? This is crazy. Do I bring them to the doctor? What's a doctor going to do for pain that only happens at night? And then you also look at their legs. You're like, maybe I see bruises, maybe I see redness. Nothing. They look completely normal. So yes, the pain is real, but how do we know if it's actually growing pains? So unfortunately, there's no specific test or imaging study or even physical exam maneuver that can diagnose growing pains. It's frustrating. You bring them to the doctor, someone like me, and I'll examine them and it'll be completely normal. In fact, that can be one of the things that makes you think it's actually growing pains because everything's normal. Sometimes you'll get an x-ray, it'll be completely normal. And there isn't even really a reason to get blood tests, although I will say pain that wakes up somebody in the middle of the night and has no pain during the day sometimes makes us think of cancer. So it wouldn't be weird if the doctor said, let's get a basic blood panel and check it out. More or less, this is what we call a diagnosis of exclusion. We exclude other things. But there are some criteria we can use to help us out. And Walter and Evans are most famous for having their criteria. Their criteria says it should be bilateral leg pain, occurring at night, not during the day, associated with normal exam findings, and has no interference with any activity. It does not prevent them from doing anything. If you check all of those boxes and you have no other associated red flags, at this point you can start to feel more confident calling it growing pains. All right, so at this point of the episode, you may be thinking, okay, growing pains are real. We have no test for them. Why do they even happen in the first place? This is one of the hardest parts of being a doctor. And one of the things that I tell patients who are like engineers or actuaries who love the equal sign, we don't actually know what causes growing pains. I cannot tell you. There are some hypotheses. One is that muscle fatigue after active days. Kids move around like crazy, and especially when they are in these age groups, they may have more muscle fatigue than the average. There can be joint hypermobility, but I will say that I diagnose kids with growing pains who have normal joints that are not hypermobile. There can be pain sensitivity differences, possibly linked to things like migraines. So kids that have migraines have an increased risk of growing pains. But again, migraines don't cause growing pains. And there are kids who have growing pains without migraines. Fact is, we have no idea what causes growing pains. And the thing you should know is, no, your child is not growing too fast or having abnormal growth or going to have any long-term repercussions from this. It's just their body and their nervous system responding in a slightly weird way that we can't explain to mechanisms that we can't even put our fingers on. It's really important to emphasize right now that growing pains are benign and harmless. There's nothing you need to do to treat them. Now, that may not help you in the middle of the night when your kid is crying and screaming and you just want to go back to bed and you want them to feel comfortable. But just know, as Darius Rucker said, it won't be like this for long. These will go away by themselves. Well, doc, that's not very helpful. Can you give me anything that can possibly help in the middle of the night? Well, massage and heat actually has shown to be helpful. Upwards of 95% of kids improve with those simple measures. So if they're hurting, rub their muscles. Get a hot washcloth. Get a heating pad. Don't leave the heating pad on and go back to sleep. I have seen burns in the office. Over-the-counter pain medications have also been shown to be helpful. You can use things like ibuprofen or Tylenol. I will say ibuprofen has been shown to be more beneficial than Tylenol. And again, you want to follow child-based dosing, which is on the side of the over-the-counter bottle, how much they weigh and how much milligrams to give them. Now, you may see a lot of things about supplementation and different types of herbal things that can possibly help with this. And realistically, no study has shown that this helps on a regular basis. And in children, you got to be very careful about giving them supplementation that adults take because it rarely has been studied on them. And they're not just little adults. It could have different side effects. One thing that can be tested for is vitamin D deficiency. And if there really is a vitamin D deficiency, supplementing with vitamin D has been shown to decrease these growing pains. So it's not unreasonable to ask your doctor, should we check for vitamin D deficiency? Anecdotally speaking, one of the things that I've heard from parents that works the best is a warm bath. It accomplishes the massage, the relaxation, the heat. Oftentimes, warm baths can be soothing to get back to sleep. You can give them a gentle leg rub while they're in the bath. All of these things can be really helpful to make them feel better in the middle of the night and allow everybody to go back to sleep. Now, nobody wants to be the parent who was reassured because they thought it was growing pains, eventually takes their kid into the doctor because it's not going away and finds out it was something more serious. So, when should you go see a doctor? You can use the criteria that we talked about earlier, and if anything is not in those 4 things, go see a doctor. So, for example, pain in only one leg is usually not growing pains. Pain during the day, usually not growing pains. Associated symptoms with the pain, including swelling or redness, fevers, limping, any sort of bruising, all of that can be a sign of something beyond growing pains. And lastly, morning stiffness, where they wake up and they have trouble kind of getting going and feel like their joints still hurt them. Growing pains goes away when they wake up. And if they have morning stiffness, it may be a sign of something like juvenile rheumatoid arthritis. Needless to say, there are signs and symptoms to see a doctor, and you'll never be faulted for bringing your child in, describing the symptoms, and finding out their growing pains. A little reassurance can go a long way. I do this for a living, but even my own children, it's great to come in, see a pediatrician who is not biased like me, and give us that reassurance so that I know I can go home, go back to bed, and that I'm not missing anything. So in closing, are growing pains real? Yes. Absolutely. Please believe your child when they come in or are in their bed crying with severe pain in the middle of the night. But the name is misleading. We have no idea why this happens, and it's not necessarily due to growth. It's just that it happens to 3 to 6-year-olds and sometimes 3 to 12-year-olds who are naturally growing. The condition is completely benign and does not require any specific treatment. But if it does happen, it is okay to use heat and massage and also over-the-counter medication like ibuprofen or Tylenol used at the correct over-the-counter dosages for the weight. Signs to look out for, again, are nighttime pain, pain in bilateral extremities, usually the legs, no daytime limitations or symptoms, and normal examinations. So the next time your kid wakes up in the middle of the night with severe pain, and you've gone through this checklist, you can confidently say, these are growing pains. Then, roll up your sleeves, get the bath going, you got some massage work to do. That'll do it for another episode of Hey Doc, Quick Question. I really appreciate you tuning in. If this episode helped you, please share it with another parent, especially one that's mentioning to you that they're up every night with their child having pain. And keep those questions coming. You can go to the website, heydocquickquestion.com. There's a way to leave a voicemail, or you can actually send us an email through there as well with a question. Happy to do it either way. And finally, it would mean a whole lot to me if you would stop for a second and hit the subscribe button so you don't miss an episode in the future. Every person who subscribes gives fuel to the show and allows me to keep doing this into the future. I can't wait to answer more of your questions, and it means a lot to be a part of your weekly podcast routine. Until next time, I'm Dr. Jeremy Alland, and I wish you all a restful sleep with nobody waking you up in the middle of the night. Hey, you made it to the end. Great. Now the legal stuff. This podcast is for educational purposes only. It's not medical advice, and listening doesn't make me your doctor. I mean, I like you, but we don't have that kind of relationship. So please, don't use this podcast to diagnose yourself or to treat other people. Always talk to your actual doctor or healthcare provider when it comes to your health. Neither I, Dr. Jeremy Alland, any guests, nor Hey Doc Quick Question LLC can be held liable for anything you do or don't do based on what you heard here. In short, this is information, not a prescription. Be smart, stay curious, and talk to your doc. Oh, and hey, send me your questions.